All right, we are live. Good morning, good afternoon, good evening, depending on when you're watching this. This is the voice and the face of Dr. Tolu Olabintan of Living Spring Family Medical Center. I'm so excited to be here today. We're going to do a retake where we're talking about ICU, how to care for your eyes. Um, for those who are watching this live, I forgot to do that last time. Please put hashtag live. And for those who are watching this on replay, please put hashtag replay and feel free to share with friends who could find this useful. All right, that being said, I'm going to hand over to my guest, Dr. Mitra Ayazifar. Thank you so much for coming again to this live. I'm going to hand this over to you and just say kindly introduce yourself. Who are you and what do you do?
Good morning, Dr. Tolu. Thank you so much for having me back so we can hear what both of us are saying. I'm Dr. Mitra. That's how my patients call me. I'm an ophthalmologist in Northern California with 2 locations. My practice name is Capital Eye Medical Group, and we help patients develop their best vision so they can enjoy life and their hobbies for years to come.
Awesome, awesome. And you're an oculofacial surgeon. Okay,
Yes.
just gonna throw it out. Yeah, she's a surgeon, so that's big. Okay, don't be modest about that. That's a big deal. And I like what you do. I love what you do. Very, very important. Now the next question I was going to ask is, why do you do what you do? If there's a story to share, we're curious to know, like, what got you into eyes?
That's a very good question. So I actually, in medical school, as I did my rotations, I had trouble choosing because I loved everything I did. I would do psychiatry rotation, go back to mom. Hey, that's what I want to do. Mom's like, just keep looking, keep looking. I did OBGYN, all of these things. And the ophthalmology was at the beginning of my 4th year, and it just seemed to combine everything that I loved with medicine.
Mhm.
So I was able to follow my patients over a long period of time, yearly exams, comprehensive exams. I am able to do surgeries, especially
Okay.
very delicate surgeries. And of course, doing cataract surgeries and doing the eyelid surgeries is, just fills a cup for me. And having a life, having control over my life, it just seemed like it was a combination of everything.
All right, so good work-life balance as well. So awesome, awesome. And that's of course, very delicate surgery, very small area to focus. So attention to detail, and I'm really impressed actually with eye surgery. It can be pretty delicate, but so thank you that you do what you do. That's pretty awesome.
Thank
Now let's talk routine eye exams. So one of the
you.
questions I ask my patients when they come in for their annual checkups or their wellness visits, I asked them, "Oh, when's the last time you saw an eye doctor?" And I usually get a quizzical look, like I can see fine, so I don't see an eye doctor. And then I reiterate, I say, your eyes you don't go from seeing the blind most times overnight. Okay, they're usually subtle changes, and some of us can attest to the fact that we didn't realize that we couldn't see very well until maybe a driver's exam. In my case, I didn't know that I was supposed to see as much as I was seeing, or I was able to see after the fact. I was like, wow, there are tree branches on that tree. I didn't know. I didn't know I was supposed to see that. But how often would you advise one to have eye exams as a preventive measure?
Um, that's a very good question, and the best way I can respond to that is that it depends, right? So if a person has medical conditions that they already know of, so let's say they go to you and see their doctor, their internist, their family practitioner, and they have risk factors like diabetes or hypertension, or even a family history of glaucoma, they should definitely be examined once a year. A lot of other things are dependent on age. So if they don't have any of those issues, not taking any medication, between the age of 18 to 34, probably anywhere from 2 to 4 years,
Okay.
the data is different. And then 35 to about 64, they say about every 2 to 3 years,
Okay.
unless you have those risk factors, then you go
Okay.
much more frequently. And of course, above 65, the recommendation is coming in every year because there are changes that happen to your lens, your natural lens, and so cataracts develop, and we really want to follow up with that.
All right. So the answer is it depends. So let's figure out your age group and risk factors. And of course, we encourage you to visit with your primary care doctor to find a customized or individualized plan for you, custom made for you. Okay. These are
That's right.
suggestions, and but eye exams are important. Okay.
Absolutely. Mm-hmm.
All right. So what are 3 to 5 most common eye issues you see in the office? What would you say?
So I'll just kind of list them, the most common. I would
Okay.
say, patients with hypertension, with diabetes,
Okay.
with changes in the eye, or simply for preventive measures to make sure that it's not affecting their vision. Patients that are at an age where they have cataracts or may have developed cataracts, they come in. Patients with macular degeneration, or they have a
Mm,
family member that has that, and of course, glaucoma. If it runs in the family or they haven't been seen and the primary care finds out, hey, that runs in your family, perhaps you should be looked at all the time. And a lot of things that have to do with the lids, like styes and, chalazion, inflammation,
mm.
um, due to different things where patients come in, why am I getting these over and over again? So that's when I see these patients a lot. And of course, with my oculofacial practice, that might be the sixth one. A lot of things having to do with the lid, where the eyelid is really almost covering the
Oh, the
lashes.
eyes.
And yeah, and patients are wondering, what can I do about it? Is that just cosmetic, or is that something that insurance pays for?
Okay. All right. Now the next question is how can I mean and this question is a little bit kind of tough to answer, I'm guessing, because some of these things, how can you prevent them? Like how can you prevent some of the most common ones? Of course, you have high blood pressure. You want to control your blood pressure. You want to do things that would minimize the risk of diabetes and things like that. But what are tips based on what you've seen, based on seeing your patients? What are things you could say to patients if you could have seen them ahead of time? Like these are things to do to prevent such and such.
You know, always, if you have any sort of cardiovascular issue or anything that affects the blood vessels, right? So hypertension and diabetes are two of those. These patients really, as they have had, especially diabetics, if they've had diabetes, they've been diagnosed, it's a longer period of time from the time of diagnosis. They have more of a chance to develop it in their eyes. So sometimes, even if their blood glucose is controlled, they can still have changes in the
Mm,
retina. So it's really important for them to be seen at least once a year and
okay.
not let the diabetic retinopathy or changes in the retina progress to a point where all we're left with is, oops, I have to send you to have laser done to the back of the eye. It's really important to just catch it early with those issues.
Okay. So catching early is very important. Preventive visits are very important. And of course, seeing an eye doctor when you have chronic conditions that could affect your eye.
Mm-hmm.
Um, Now, what would you say are 4 to 5 tips on how to preserve your eyes? So we're talking keep them healthy, keep
Mm-hmm.
them seeing, and things like that. What would you say?
Um, I would say, some people are surprised, like we talked about this story. Some people are surprised that they don't see things as well as they should. So maybe they haven't been checked for glasses, definitely making sure that you actually go and see your eye doctor and be checked for, nearsightedness, farsightedness, to see all the lines in the leaves and the trees and everything else. The other thing is to make sure that if you wear makeup or even if you don't, that at the end of the night, you remove all makeup at night, because sometimes the pigment in the eyeliner or mascara
Mhm.
or whatnot can actually clog up the oily glands in the eyelid. And we have 80 or 85 of them. And so that's when I see things like, and you probably do too, things like styes or, little area on the eyelid that's swollen, that's may even be crusty and just causing vision problems. So all of that can be prevented by having a good lid regimen where you're removing the makeup, and making sure that you're aware of any changes in your vision or irritation. Um, a lot of times patients ask me about the eyelashes, and
Mm-hmm. Little fan. Yes, yes, those.
I
Mm-hmm.
tried it after I did myself some personal research, so I can attest to this. So if you eyelash extensions are not my favorite thing, because when you, number one, of course, the expense, but if you're okay with that and the time it takes to, replenish it every however many weeks, the issue with that is that it stays on the eyelid margin. It's glued on, and it's not like you can, clean in between or make sure that there's not bacteria overgrowth, other things like that.
Right.
So that's something that causes issues with eyelid health. I also say for the back of the eye and in general for the body, you want to include vitamins and minerals that are good for your immune system, good for your eye health, everything. So green leafy vegetables, unless you're on blood thinners, you have to ask your doctor. Um, like spinach, kale, antioxidants like vitamin C. I like the fresh kind. So when pomegranates are in season, when blueberries, you can get blueberries, eat those, as they come, and all of that. Your good diet is going to help take you a long way for sure.
All right, awesome. So I didn't tell her to say that. So good diet is actually good for your eyes. So fruits and
Yes.
vegetables, and be very careful about makeup, including eyelashes. I know they look pretty on, like little butterflies, but you have to be very careful. The risk of infection and clogged ducts are real. So really important to check that. Now I have a patient who's asking here. She says, "Are cataracts and glaucoma treatable to a point of full recovery?"
So, glaucoma, I'll just explain a little bit, but cataracts, yes. So, cataracts, the only way right now that we have to treat them, and for years and years, is to have cataract surgery, what that means is that cataracts are your natural lens, you're
Mhm.
born with it, it's like a clean window. And then over time, with age, with certain, issues in the environment, if you're a smoker or have other cardiovascular issues, you tend to have progression of the cataracts faster. It it's almost like that window becomes a little dirty, a little dusty, and
Mm.
then it gets to a point where we're not able to give you a pair of glasses that you can see through that dirty window. And there are no drops or anything that's going to make it go away.
Mm.
So it gets to a point where we have to perform cataract surgery, which means to take, it's that microsurgery where we have to take that lens that's now cloudy and replace it with an artificial lens. The wonderful thing about cataract is that as long as your retina is healthy, you don't have issues going on from before with scar tissue or other things that damage the retina, you can have excellent vision once you have your cataract surgery. And with the newer lenses, artificial lenses that we can replace the cataract with, you can practically have, some people can have a range of vision where they might not even need to wear glasses, which is amazing. I think it's amazing.
Okay, so
Cool. Mhm.
glaucoma was the second one. Yes.
Yeah. So with glaucoma, early detection is quite important. So, for instance, I have glaucoma in my family. So it's very important that myself and my brother that we're checked on a yearly basis, at least, making sure that the ophthalmologist takes a look at my optic nerve because that's where damage happens, and it's not reversible.
Mm.
Because once damage happens, what happens is we gradually lose peripheral vision. And unless it is progressed to the point where, it's quite damaging as far as your peripheral vision, we're not going to notice. It doesn't hurt. Most of the open angle glaucoma, it doesn't hurt. You're not going to notice that you're losing vision. And it just happens so gradually, so softly that, people are at one point are left with like a clear a little tunnel vision where everything else is gone. So it takes away your peripheral vision.
All right. So prevention, 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 and that's big. The way to do that is to have eye exams, of course, customized to your family history, and then, of course, knowing your family history. Is there anybody in the
Mhm.
family that has cataracts or glaucoma? Then the risk is, increased for that patient or that person, and so screening early is important. Awesome. Thank you
Mhm.
for answering that question.
Just a
Um,
just a quick addition to that. So it's
yes.
not reversible, but it is treatable, meaning that we can control and prevent progression for glaucoma. I just want to point that out.
Okay. So for glaucoma, it's possible to prevent worsening. Okay.
Correct.
All right. Good to highlight. All right. Next question I had from a patient is, each time I see my eye doctor, I need stronger and stronger prescription glasses. I worry my eyesight is getting worse. And sometimes I've had patients say they don't want to go back because they don't want to hear that they need a stronger pair of glasses. What would you say to that?
So I would say up to at least, at the age where we're closer to 40, we are definitely going to need glasses for, reading, being able to focus close up. Some people can get away with it. I'm trying to fight it still. But definitely, even if you see well in the distance, we lose the ability to accommodate, which is, focusing the eyes, bringing the eyes close and focusing on something nearer to us. So that's when people say, oh, I don't have arms long enough, because you have to keep, holding things farther and farther. So definitely reading glasses will be in all of our futures. And also maybe you have an undetected vision, refractive error, meaning the shape of your eye is such that you're really not seeing the things out there as clearly as you should, but you don't know any better until you go and see the eye doctor. So yes, your vision can change. The older we are, the more mature we are, we're closer to developing cataracts that are visually significant. So obviously we want to be safe. Obviously we want to make sure that we're seeing our eye doctor in order to diagnose those and treat those. So keep up
All
with
right.
those eye exams.
Awesome. And you mentioned something early that was prevented. We didn't kind of stress it. Smoking doesn't help the eyes. So no smoking is a good preventive measure to preserving your eyes too. Um,
Mm-hmm.
I wanted to ask real quick, and this is a spontaneous question, more about eye drops.
Uh-huh.
Um, are there eye drops to, like, what are your thoughts on them? Some people say I have itchy eyes, so I just went and got an over-the-counter eye drop. What are your thoughts on them? Should one be cautious about using eye drops? Um, um, what would you say to that?
So I guess it depends on what you're using the eye drops for, and
Okay.
whether or not when you get the over-the-counter medication, over-the-counter drops, whether that helps you.
Okay.
So number one is itchy eyes. A lot of times patients develop allergies even several years after they've lived in a certain area. So perhaps the over-the-counter, allergy eye drops are not going to help you. Or maybe it's not allergies. If it doesn't go away, maybe it's something else that you really need to go and see your eye doctor for. Artificial tears to lubricate the eyes are
Hmm.
perfectly fine. There are many ones that are over the counter. They're very similar, and unless you are allergic to the preservative that's in those eye drops, where you
Hmm.
have to buy the individual ones, individually packed ones,
Package
then
one. Okay.
yeah, packaged ones. You're more than welcome to use that, especially if you work a lot on the computer, if you're doing a lot of reading close up. I always recommend, make sure that every 10 minutes or so, you kind of close your eyes, take a little 5-second break, or even focus in the distance, just to give
Ah,
your eyes a break, give your muscles a break, even if you're wearing glasses, and then get back to what you're doing. So eye drops are okay. But if your problem continues, you need to have it evaluated, because
all
maybe
right.
you
You
have
heard the
severe
doc.
dry eye.
You heard the doc. Eye drops are okay. If it's not getting better, you got to see your eye doc. And I love the emphasis on taking a break, staring at the screen. I've seen patients with quite a few headaches that was attributed to just staring at the screen. So taking breaks, closing your eyes, I like it. I almost want to do that right now, um, but taking those breaks are important, especially with staring at the phone and staring at the screen. Very, very helpful stuff, Dr. Mitra. Thank you so much for all of this. Now, I know
Thank you.
people are watching and they're wondering, this doctor is awesome. And she says she has a practice somewhere. So, where can people find you? Where can people find you to reach out to you as well?
Absolutely. So my practice is in Northern California. You can find me online to get some more information as far as what we do and how we take care of patients. The website is www.mitramd.com, MITRAMD, or www.capeyemed.com, CAPEYEMED.com. Northern California, Grass Valley and Roseville, close to Sacramento. Come see me.
Awesome, awesome. This was awesome. Thank you so much for coming. I'm honored to have you, my friend
Thank you.
and eye doctor. um, this has been good. So for those who are watching live replay, please share with those who could find this useful. Share it with your friends. Sharing is caring. And if you or anyone you know is looking for an awesome, thorough, and passionate family physician here in the Mansfield, Texas area, I am she. Thank you all for watching. Have a good one.